Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hi, I want to welcome everybody to the MS&Me Radio Network. This is Kelly Alberton, and we are talking about each week, Live in Hope, focus on healing while we're dealing with our MS. I am a mom, I'm a wife, I'm an MS warrior. I'm also an author of the book, Waking Up from MS, My Journey to Health, Healing, and Living Symptom-Free, that really talks about my almost 30-year journey living with MS and beating MS. Now, I'm really excited about today's call because, as you know, I'm always trying to bring to you holistic alternative therapies that we can focus on for our healing. And today I am having the pleasure of interviewing Dr. Mark Freund, and he's from the North Shore Atlas, and he's going to talk today about Atlas correction or Atlas adjustment. So welcome, Mark. I'm really happy to have you here.
Thank you, Kelly. Thank you for having this discussion. I appreciate it. There's so much to learn about the Atlas and how can it affect MS and the rest of the body. But first of all, your book, Waking Up from MS, great book. Everybody should have that, and everybody should read it.
Thank you. I appreciate that. Dr. Mark, now let's talk, what is Atlas correction? I'm hearing about this all over. I'm hearing about it in the UK, in Italy, all around the U.S., and I really felt, all right, I have to start investigating this because it's being used as an effective tool to help people with MS. So can you talk about that for us?
Yes. First of all, the atlas is the topmost vertebra, which sits right below the skull. There's an opening called the foramen magnum, which is where the spinal column goes down with the nerves that go to the rest of the body that cause your arms to move. It helps with the organs function, lets you walk, but it has to go through this area of the spine, through the bottom of the skull, before it gets to the rest of the body. So what happens with a lot of people, the atlas can be subluxed or not in full alignment. And when that happens, people suffer with all sorts of different types of problems. Their organs don't function properly, they're off balance, and their spine isn't exactly straight. So an atlas correction is to straighten that bone out with the relationship of the skull above and the rest of the spine below. And there are a few techniques that do this, but my technique is called Atlas Orthogonal, which is a technique that we use x-rays to measure how far off the atlas is off and correct it with a very delicate instrument.
Interesting. Now, can I do this if I have lesions on my cervical spine? Does that, for a lot of us with MS, that is something, we know we have those lesions not only on our brain but on our cervical spine. Are we still able to do that if we have that condition?
Yes, because it's extremely delicate. A lot of people have seen chiropractors and had their neck adjusted A lot of times they're either sitting or they're lying on their back, and someone grabs the head and the neck and does a physical thrust, which results in a pop or a crack. What this is, the precision upper cervical adjusting, is a measured placement of the body based on what the x-rays reveal. We measure to 1/4 of a degree how far off the atlas is, and then we use a very, very small amount of force to nudge the atlas back into its optimal position.
Okay.
So if there are lesions in the cervical spine, this will not disrupt it, and in fact, if there's pressure on the nerves in the form of the spine being off and compensating, if it removes the compensation or the imbalance, then there will be less torque or pressure on the nerves, and then people will function better.
That makes sense, and that's great to know. So this can really, everybody can do this. Now, we were talking about regular chiropractors, and what if someone's saying, I already have a chiropractor, and he says that he can do this specific, precise, therapy? Is that true?
Well, we are trained to adjust the atlas in chiropractic school, but it's a manual adjustment, again, which involves taking the head and mobilizing the head and the neck. We like to call that just a mobilization or manipulation. The atlas orthogonal, the upper cervical work, we like to call that an adjustment, because the difference between an adjustment and a manipulation or mobilization is we measure and we put the line of force in a very specific direction based on which direction it's off. So if you mobilize a joint, that's moving at an all range of motion and direction, but if you specifically adjust a joint or an atlas, you know exactly which direction it's going in, and you're using a very small amount of force.
Got it. So that makes perfect sense. So it's more precise of a treatment and not so generalized, because you have those x-rays, because you can see what you have to manipulate to get everything into alignment, correct?
That's correct, and we perform what's called triplanar plotting. What that means, tri is 3, planar is when you have an x-ray, it's flat, so one plane, and then plotting, we will measure the individual structures, we'll put a dot on, we'll take the angles, we'll measure the degrees, and we do it in 3 dimensions. That's where the tri part comes in. We'll if you remember from geometry, the x, y, and z coordinates, or algebra even, x goes in one direction, y goes in the opposite direction, and z comes in the 3rd dimension. So we're actually adjusting in 3 dimensions, not just one.
Okay. Now, Dr. Mark, how can Atlas help my brain?
This is a very interesting question. If you go back to what I said about the bottom of the skull, or the opening, the foramen magnum, and then below that is the atlas, and then below that is the rest of the spine, the cervical, thoracic, and lumbar, which is neck, mid-back, and low back. If the atlas is not in true alignment, then there will be something like a kink or a misalignment, and the flow between the top of the neck down will be altered a little bit because it doesn't have full flow. So there's been studies. There's a new system called the glymphatic system. I don't know if people have heard of the lymphatic system, but that's a system within the whole body that has a very specific purpose of interstitial fluid movement, nutrition, waste products. The glymphatic system is what relates directly to, it's named after glymph, the G part, is named after the glial cells, which is brain tissue. So the glymphatic system has to do with lymphatic in the brain. So if the flow between the head and then the neck below isn't open optimally, you can have back pressure. You don't get rid of all of the metabolites or waste product from brain metabolism or brain function. The brain is extremely hungry and it needs a lot of nutrition. But when you eat, you give off waste product. So if the systems aren't in place to fully eliminate waste product, it builds up. And what they're starting to find with the tau proteins from concussion, people with concussion that are in pretty bad shape, they have tau protein clusters, which could be the buildup of waste product that wasn't flushed away properly. We're doing research in the Atlas orthogonal discipline where there are upright MRIs being performed, which can show the cerebral spinal fluid flowing before the adjustment and after the adjustment. And with the concussion work that they're doing, you can see a marked difference between before the Atlas adjustment and after the Atlas adjustment of how much the fluid is flowing. And with that fluid flowing, it's eliminating a lot of the waste product. There was an ESPN special February of 2016 that showed Jim McMahon getting the Atlas adjustment and his comments on what a difference it made in his life. And all that did was that opened up and realigned his neck at the top. You can see the Atlas orthogonal instrument. That helped eliminate a lot of the metabolites or waste product that were basically stuck and causing him to have his symptoms.
That's interesting, and I actually, of course, from Chicago, know Jim McMahon and that whole story. But it's interesting, you were talking about the upright MRI, and that seems to me that just seems like common sense that we would want to have it upright because obviously we don't know what causes MS, but one of the theories is that it's vascular, right, that we have that blood flow in the veins, in our neck and everything. It's not draining properly, so that's very interesting. And you perform that MRI or that type of procedure at your place, or is that something specialized we have to go and get?
I do not perform that MRI, and that would be something very specialized. And this is done with research. So I know of one person that has access to that on the East Coast, Dr. Scott Rosa. He does a lot of research for Atlas orthogonal, and he's made a lot of really good discoveries, and he's the only one I know of that has access to an upright MRI. But we can take his findings and work with his findings, so we don't have to do the upright MRI on every single patient. And there's other things, too. There's called a Chiari malformation, which is where the bottom of the brain, the cerebellum, it kind of falls down into that passageway. It goes at the Atlas level or below, and it should be much higher, and that can also block the cerebral spinal fluid from flowing properly, which can allow the metabolites to build up and the waste product to build up again. But it would be wonderful if every single one of us had a research facility to work in, but we have to just use the brilliance of others that are doing this and work with that.
And I guess that's where we're lucky, and we know from other people that have done that had the upright, we know what this Atlas adjustment will do for them, and you, just by taking the x-rays, can monitor how your Atlas is moving, how everything will be flowing, so you don't have to really undertake that whole procedure. Now, Dr. How can it help our nervous system? Because we know, MS affects, central nervous system. How can the Atlas adjustment help us and help that nervous system?
By removing any kind of impingement or impediment to normal nerve flow, nerve function. So the Atlas orthogonal adjustment puts the spine into proper position. It gets rid of the compensatory curves that have developed with the Atlas being off. And once that happens, the nerve flow or the way the nerves function is allowed to work optimally. And does that answer that question?
It does. So this is helping our brain. This is helping our central nervous system. Now the next question is, how long will it take to see results?
That's a great question. Everybody is so individual. It varies. Mm-hmm. Some people instantly, they wake up and everything gets corrected and they'll hold for a really long time. I have patients that hold for years. Other people, the muscle, the tendon has reached a level where one side's short, the other's long because of the compensation that's going on. We look at, to assess if someone needs the adjustment or not, we'll look at the top, at the neck, and see how the people respond to touch, to palpation of that, and then we also look at the leg length. Now, if the leg length is typically off, that shows that the body has gone through compensatory curves or it's compensating for the topmost vertebra being off. So after the adjustment happens, when that corrects itself, then we know that the compensatory curves were removed, but the muscles are used to having a certain length, either short or long, so that may take a little bit longer for the muscles to go back to equal from side to side. And then also, I don't just adjust the atlas. I think that the rest of the spine needs to be looked at. What we're finding, and at my office, I work with a physical therapist who does glymphatic work, and then I work with someone who does myofascial release, which will also work on all the musculature and the rest of the body. And the pelvis is extremely important. The SI joints have to be mobile. You have to have proper movement in the SI joints in order to have proper spinal coupling and movement.
That makes perfect sense. Now, I have another question for you. Will it help someone in a wheelchair walk again?
I don't know, and I like to be conservative with what I promise people. I have seen people with walkers or wheelchairs able to get up and have better balance and walk around better, but everyone's an individual, and I don't know if they're benign or if they're not benign, different levels of severity of the onset of the lesions of MS.
Okay, and just to let the listeners out there know, I have been, studying on this topic for quite some time now, but I have heard of a lot of people being able to get out of their wheelchairs, or it helps them walk better. So we have a lot of hope in this procedure. Now, Dr. Mark, is it ever too late to do this?
No, it's not, because if the bone remains where it is out of true alignment for long term, eventually you can keep going down the path you're going down, but when you get it corrected, something's going to happen, whether it be the low back, brain function, better cognition, better balance, less brain fog, foot drop goes away, things like that. Something will happen. So I believe it's never too late. The sooner it happens, though, the less chance there are of people going on the medications, and I don't know how the medications help or not. That's something you can discuss. But the sooner it's done, the better. But again, nothing will compensate for a poor diet, not exercising as much as they possibly can. But this will augment life and augment function.
And I'm glad you had mentioned the DMDs, the disease-modifying therapies, because anybody who knows me and how I turn my MS around, it was by going with holistic and alternative therapies, while I watched my twin sisters on that actually progress on the DMD program. So I'm so glad that we have another therapy that we can use to really align our spine, align our body, and get it working properly. And I often tell people we weren't born with MS. Something is off in our body, and we just have to fix it. Fixing it, in my opinion, cannot be done with the DMD, a therapy that just main focus is to suppress our immune system. And I've seen people sick constantly from it and have their disease progress. So, again, this is an alternative to that. And I'm hopeful that other people will jump on board as well with another, helpful therapy for us to use with this atlas adjustment. Now, Dr. Mark, how has this helped your other MS patients? What are you hearing from them?
Okay, and I'll answer that in a minute. You brought up something really important too, of and this is kind of a tangent, but I was given a paper called Gut Microbiota Regulate Motor Deficits and Neuroinflammation in a Model of Parkinson's Disease. It was Sampson et al. In Cell Magazine 2016. I know this is Parkinson's disease, but you need to correlate this back to, the possibility that MS is due to gut microbes being off. We need to do research on that, but just in case 20 years from now we come back and say the lesions were caused by some kind of biome issue or bug issue or imbalance in the microbiome, why don't we start now saying let's change and have that most optimal gut microbiome? And part of that is you need to make sure you're healthy. You need to make sure your gingival or dental health is properly maintained, because a lot of the gut microbiome is off because people have gum disease. So we just need to start eating better. And diets like the Swank diet or anti-inflammatory diet will help with that. So sorry about that tangent, but the body
helpful.
Need to treat the whole body. And again, in 20 years, research may come back and say this was the gut microbiome. Start now. Start changing your gut. Look into getting your gut healthy so you can handle whatever kind of bug comes in.
Absolutely. So
the symptoms. Sorry.
How has this helped your other MS patients?
The reports that I've heard are less fatigue, more energy, better balance, better sleep. Sleep it's so important because during sleep we regenerate and we grow and we heal. And a lot of my patients, I call them sympathetic dominant. That's where they're constantly stuck in fight or flight mode, and they can't get out of it. A lot of times it's due to they just have anxiety, or they have so much pain, or they just can't sleep because of diet. They eat inflammatory food, so they're constantly snoring. Once you downregulate the sympathetic nervous system and upregulate the parasympathetic nervous system or the rest and digest system, then you're able to heal and function better. And you can do that through many means. You can do that through, again, the Atlas adjustment that removes the stress on the nervous system. So a lot of times the first adjustment, people will come in and they'll get that, and then they'll go home and they'll collapse for a few hours. They get a good sleep and they get a nap. It's like everything finally calms down. And so to move on from that, people also report clarity of mind. They have less cold extremities, less brain fog. Things as crazy as their knee pain went away because their whole structure changed. Their low back feels better. The TMJ symptoms got better. It helps with trigeminal neuralgia. It helps with all neurologic issues.
Now, Dr. Mark, we're just getting at the end of the call here. Can you please let our listeners know how they can connect with you?
My office is in Highland Park, Illinois. It's at the border of Highland Park, Fort Sheridan, and Lake Forest. It's on Western Avenue. It's 3500 Western Avenue in Highland Park, and the zip is 60035. The phone number is 847-780-6068, and the email is northshoreatlas@gmail.com, and then the website is northshoreatlas.com.
Dr. Mark, I want to thank you so much for being on the call. I'm going in for my first Atlas adjustment this Thursday, and I will let the listeners know about that and how that goes for me. Even though I'm living symptom-free, I want to do everything possible to optimize my health. Remember, MS&Me Radio Network is available to you 24/7. I want to wish